Now, one of the ways to monitor adequate circulating blood volume is to monitor urinary output. So you put a catheter in the bladder, you empty what they got in there, and then you monitor the urine output. Initially, in a shock state, they're going to have little to no urine output. As you improve their circulating blood volume, you improve renal blood flow and urine output. So urine output is a way of evaluating whether you have adequate circulating blood volume. They also will sometimes tend to be confused and disoriented. Why is that?
You have oxygen to the brain.
Hypoxia. There's our little chart again. All right, this is just a review of what we've talked about. Now, one thing is blood pressure is, we can usually maintain our blood pressure if we lose somewhere in here of our circulating blood volume, around 15 to 30%. 15%, you're good. By the way, when you go to the blood bank and give blood, what approximate percentage of your blood volume are you donating as an adult?
No clue.
About 10% max. Because they take a pint of blood, that's around 500 milliliters. So an adult male that has, or a female that has a circulating blood volume of 5,000 milliliters, and you take 500, you've taken about 10% now. Now, most people, no trouble with that. They get up off the table and get their t-shirt and walk out, right? So you can handle 10%. 15% maybe, 20. But the closer you get up here to 30, you're getting into compromised territory, and especially when you get over this. You can't stand this.
Now, Doctor, Professor, now I know you mentioned earlier that in the last lecture you mentioned the more exercise one gets, the more you can increase your blood levels.
Your cardiac output.
Cardiac output. So, like, say if someone just gives blood, like at 10%, obviously your blood count is lower, not by much. Obviously you can get around and do stuff, but is it wise to go and say do some form of physical exercise after that?
It's not unwise. If you feel like it.
Yeah, they say not to for the next 48 hours.
Yeah. It's probably a good idea to temper what you do. Use common sense. But they tell you to hold off just because, and they probably are on the really high side of that as a precaution. So this is how you, you're out of time. I want to get back here to irreversible shock. What happens when you don't come back from acute circulatory collapse? You're in what is known as irreversible shock. What happens in those states? In other words, your body's homeostatic mechanisms have put out all they can do. Medical people have done all they can do. But you're not coming back. What happens is you get widespread, uncompromised, in other words, your vessels have constricted all they can do. They can't do any more. Your heart can't do any more. You get peripheral vasodilation. This drops your pressure. Capillaries collapse. Blood flow stops. Cells disrupt, and you die. Now, there are different things that will cause this and bring it about, but this is the terminal result for irreversible shock. All right. Any other questions?
That's mindful.
Yeah, it's a lot. All right, now, On Wednesday, remember, we're not having the test.
Right.